Today we'll be looking at effects of poor menstrual hygiene and its management. So let's define our key terms. Menstruation is a natural bodily process of releasing blood and associated matter from the uterus through the vagina, while menstrual hygiene refers to a constellation of personal sanitation during menstruation, and it involves use of appropriate sanitary pads, bathing regularly, and changing your clothes. There are different things that can be used as absorbents during menstrual cycle menstruation. Basically, you can use tampons, you can use pads. There are also reusable pads, menstrual cups. In some places, people use tissue paper, handkerchief, and all because they don't have money to afford a healthy absorbent. When we talk about poor menstrual hygiene, we are looking at those unsafe practices that could affect the health of the person, like wearing a dirty or damp underwear, wearing a pad for too long, not bathing often, and using unhygienic absorbents, like I said earlier, tissue paper and all. Then improper cleaning of the vagina can also cause poor menstrual hygiene. So what are the effects of poor menstrual hygiene? You have low self-esteem. Some girls don't go to school when they're menstruating. Some are ashamed and embarrassed. They have body odor. It can also lead to a whole lot of infections like urinary tract infections, reproductive tract infection, and skin rashes as well. There are signs and symptoms of reproductive tract infection. You can have genital itching, back pain, abdominal pain, pustules over the genitalia, and abnormal discharges. How do we manage this? Wash your hand before and after changing pad with soap and water. Wash your private parts very well. Use clean and comfortable clothes as well as underwear. Then change your pads as often as you should. Do not use vaginal products or soap, and try to dispose your pads or tampons or whatever you use properly. Don't flush it down the toilet. Wrap in a paper and discard in a lid. Thank you so much for listening.